Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Fallopian tube. The length of the fallopian tube. The length of the fallopian tube is 4 centimeters or 10 to 12 centimeters long. The length of the fallopian tube is 4 inches or 10 to 12 centimeters long. Parts of the fallopian tube: interstitium, isthmus, ampulla, and fimbrium. Interstitium or intramural part is 1.25 centimeters long and 1 millimeter in diameter. It is the narrowest part of the tube and it has no longitudinal muscles and it only has circular muscles. And these circular muscles will act on the anatomical sphincter for forming the tubal ostia. Isthmus. Isthmus is 2.5 centimeters long and 2 millimeters in diameter. Isthmus is the second narrowest part of the tube. Isthmus acts as physiological sphincter and isthmus will form broad ampulla. Isthmus acts as physiological sphincter, especially isthmus is present or it acts as physiological sphincter from the broad ampulla. Here the conceptus comes to the narrow isthmus. From the broad ampulla, the conceptus comes to the narrow isthmus. Then the third part is ampulla. Ampulla is the widest and the longest part, which is 5 centimeters. Fertilization occurs in the ampulla. Ampulla has mucosal folds which are called as plicae. Fourth, fimbrium or infundibulum. Fimbrium or infundibulum is 1.25 centimeters long and it has a maximum diameter of 6 millimeters. Histologically, on histology, fallopian tube has PEG cells and fallopian tube is lined by single layer of ciliated columnar epithelium. Most common
thank you and thank you for watching.